Hi, good afternoon, everyone. I'm Dr. Prathima. I wear two hats. I'm a doctor and as well as a patient. I just turned 44 yesterday. So I was diagnosed. I was diagnosed when I was 38. So this is my year 6 of young onset Parkinson's disease. So I'm going to talk about women and YOPD. So I'll be giving some advice to patients and giving some advice to the doctors as well, because they have to know the patient's perspective as well. So moving on. So why women? We know about the statistics. The prevalence of PD in India is around 15 to 43 per 1 lakh. That's a rough estimate. Now, if you see everybody under 50 years, like juvenile onset, young onset, as well as YOPD, it's around 40%, that is half. Now, number of females, no statistics. We don't have any numbers. We know that women are less affected, but we are still there. We are not the center of the universe, but we are still the center of the home. We are still the center of the family life. So we are important, and that's why we need to know. We are the caregivers. We are the mothers, we are the sisters, we are the daughter-in-laws, and we are the predominant caregivers. And having YOPD at this age, it really takes a toll on you. And it's a very largely unexplored area. We have our own unique needs. So my next slide is mainly based on information from this paper. So what are the fundamental differences between YOPD? I'm only talking about YOPD between men and women. So with regards to the motor symptoms, we have more tremor dominant, there's more facial masking, and we have more dyskinesias compared to the men. This is all compared to the men. And the good thing is we have less disease progression. Coming to the non-motor symptoms, as women, we are always more prone compared to the men for non-motor symptoms, depression, low mood, and so all these things are more in us. And the better thing, we have less cognitive impairment, we have less hallucinations, and we have less sexual dysfunction as well. Now, psychosocial, this is the most important factor. We are prone, like females, we are more prone for psychological distress. We have a lot of negative image. Consider women as such, we like grooming. So we are always, that's why we have so many clothes shops, makeup shops, whatever you think, whatever it is. But we want to groom. Now, it's very difficult when I'm off to just do my hair. So if you see YOPD females, most of them have very short hair. It's very difficult to do daily activities when we are actually off. And on top of it, I had to do the same to my kids, send them to the school. So there is a lot of negative image there because of all these factors. We had to work, we had to look good, we had to maintain the home, and we had to attend family functions. My biggest trigger factor, anxiety is the family functions. Because I had to get ready, I had to get my kids ready, and I had to look brilliant. Right, so what is the cause? Now, being a caregiver as well as YOPD, the emotional exhaustion is huge. Now, women are predicted as this, multitasking. So I had to do everything, which probably will not happen. And like my previous speakers have already spoken about, like when you're on, you feel like a superwoman. You want to do everything, you want to, like talking in this seminar as well, but that was when I accepted this during my on period. And when I'm off, I keep thinking, why did I do this? I have so much other things to do and all those things. So when you're on, you feel like a superwoman, and you just try to do everything there. But here you have to understand, like what Geeta ma'am said, you have PD, you have to prioritize, we have to prioritize, and we have to walk along with PD, not before, not behind. Right, management-wise, there's always delayed diagnosis. YOPD as such has different presentations, and female as such are the last to diagnose because it's very rare in females, and they can have very variable presentations. And women don't speak. There's a lot of stigma. And they have this inability to articulate. You have to understand women can't express themselves when it comes to symptoms. When I was a medical trainee in UK, there is this syndrome called whole body syndrome, which they used to do it for the Asian females. Like when you ask them where's the pain, they say like it's everywhere. So majority of the females from the villages, they can't articulate. It's the clinician's job to extract the history. It's not the patient's job. History taking is an art, and it's the clinician's job to extract the history. Yeah, we talked about personalized care. So what about personalized care in women with YOPD? You always have to think about pregnancy, which is very rare, but we still have a couple of females in our WhatsApp group who had gone through pregnancy. And menstruation, obviously there's menstruation. The thing is, perimenopause, we go through this stage. Anybody below 50 go through perimenopause, and you have a lot of mood swings. We don't know whether it's because of PD or whether it's our menopause, whether it's the hormones. Estrogen does affect the brain, and how does it affect? Whether it's good to give HRT, or is it good to just increase your dose for those few days? This is something subjective. This is something we need to explore. So estrogen, HRT as such is not a contraindication if you are PD and if you have symptoms. But this is largely unexplored. And along with that, women, when we go through perimenopause, menopause, you have to think about osteoporosis, your general health. May not be a neurologist, but go and see your gynecologist or a general physician, or the doctors. The neurologist should advise the female patients to go and see the other specialties as well. So wellness strategies have already been covered, but you need to educate the female patient more than the male. Emotional health is very important, and you have spiritual health, like chanting, singing, meditation. All these things give you a balance, kind of, even with all these adversities, you have a meaningful life, right? It's not all this ground you down, and in this huge universe, you do have a role to play, even with all your limitations. So I don't know whether you heard about neurographic art, but this is quite calming, and it's very easy. Anybody can do it. So it's a way of art therapy, mindfulness art. Well, that's a crappy art, but others have done it well. Yeah. Like the previous speakers told, you have to develop your own interest. It is well known people on dopamine agonists and PD have more creativity. So yes, explore your creative work. I did write my book as well. Sorry to use this platform to promote my book. But that's not about PD. That's about interpersonal relations. Okay. Exercises, yes, we do have to rotate between cardio, yoga, tai chi, dance, boxing. We have a longer life. I was still at 38 when I diagnosed, so I learned boxing for 1 year, and then I went for dancing for another couple of years because it gets boring. Doing the same exercise, mandate, you have to rotate between all the different exercises. Yeah, finances. It's not a major issue for females in India because we are not the bread earners, but that's changing now. Now, for the next generation, you probably need to make money as well. But the societal obligations, when you're a female and you have YOPD, you naturally give up on your career. Your family becomes your priority, and even if you work, you're not paid at the same rate as a male. I'm not trying to make this as a male versus female, but that's the truth. Fortunate or unfortunately, we know that women outlive men. So you always have to think about your pension schemes as well. So when I was just going to the literature, the top unmet need for men is the help with their employment. That's the YOPD patients. And the top unmet need for women is community more like me. we are very few numbers. YOPD in women is very rare, so we are very few numbers. But we need somebody to connect, somebody in our age group, somebody going through the same problems. And women in India don't usually talk. I'm the one who talks everywhere. But generally, women don't talk that much. They don't talk about these symptoms. It's kind of a big stigma for them. Right, so I am very grateful for all my friends for this video. Just a little task for all of you. If you can identify me. Volume. Karthik? All right, did you guys identify me? Well done. Anyway, thank you. Thank you for giving me this opportunity, Dr. Prashant.
Thank you so much, Dr. Prathima.